Prioritization. This simply means something that's priority. And priority simply means something that's important, mandatory, something absolutely necessary. When you're talking about prioritization of care, we are simply referring to your ability to decide on which client need or problem is most important to be attended to at that time. That patient you will first go for to care for. Questions can come in different form in the NCLEX. It can come like, say you're given a group of patients. Keyword here, a group of patients. That is more than one patient. Say like in an emergency department and you're asked, what patient you would first care for. That patient you first go and attend to first. Or you can be given just one patient. Keyword here again is one. Okay, this is not a group of patients this time, but one patient. And this one patient with a particular disease condition, and you're given a number of interventions and the options of that question, and you're asked, which one would you go for as your first intervention? Which one would you go for as your priority intervention? Questions in the NCLEX can come in these forms. These are like the most popular ones, or other kinds too, which are available, but these are like the very, very popular ones. And it's very important you are able to identify the kind of prioritization question you're dealing with at that point, to be able to know the method to apply in answering these questions. There are different methods used to prioritize care or used in prioritization of care. And number one is chronic or acute method. You ask yourself, is it new onset or not? Has it been going on for months, for weeks, for days, or did the symptom just start now? About a minute ago or hours ago? This questions matters. If it's new onset, it just started, I definitely would be bothered. Okay, that care would be priority on my list. It could be life-threatening as opposed to symptoms that has been ongoing for weeks, for months, that are basically chronic. Number two would be the expected or not expected method. Your knowledge of this patient disease pathophysiology goes a long way to help you determine what is expected and what is not expected. Your knowledge of content goes a long way here for this particular method. For example, now, a patient presents with pancreatitis, and has a blood glucose of, say, 250. I wouldn't be bothered about this as it is expected in a patient with such disease condition. It's expected with a patient with pancreatitis. So, it sounds abnormal, it sounds scary, but at that point, it is not life-threatening. So I am good. So I will move on to the next patient and come back later to that one, give some insulin and we are good. So my only concern will be when the presenting symptom is not expected. Say my patient with pancreatitis all of a sudden started having like a fever of like 101, 102 with some severe abdominal pain that's increasing, then yeah, that sounds like danger. Like something is definitely going on. Say an abscess. So this is how you make use of this method. The number three method would be the ABC method, and that is the airway, the breathing, circulation. And as we know, airway would always come first. Try holding your breath for like 10 seconds, 10, 15 seconds. You know how hard that is? That tells you how important, how significant the airway is. A patient presents with increased respiratory distress, oxygen saturation of like 89% as opposed to 95%, at least where it should be for a healthy individual. That will be a concern for me. That will definitely be a concern for me because airway will always come first. But again, we have to note this, take for instance, using the expected and non-expected method, for a patient who presents with CHF exacerbation, has swollen legs, is short of breath, these are like expected findings, owing to the disease process, what we should expect from a patient with CHF. I won't really be bothered about the swollen legs because it's expected. But you see, for the shortness of breath, which is also expected, I will be bothered, because if I am using the ABC method here, airway will come first, and airway will always be priority. I mean, this patient could be down with pulmonary edema, could be down with, pleural effusion. So, there have to be like an immediate intervention to help this patient feel better at that point, or to breathe better. So you want to give Lasix, you want to do a chest x-ray, you have to do something, you have to intervene. So using the expected and non-expected method, shortness of breath in CHF will not be a priority for me. But when I'm using the ABC method, it will be priority as it falls in the category of airway. So, summary here is that we have to be able to know when to use the method of prioritization and when not to. You should be able to know when to switch from one method to another. And of course, all this comes with constant practice. And of course, knowing your content. It's very important. Our next method would be what I like to call, intervention in place. Simply refers to when a patient presents with a particular symptom and there's already an intervention carried out to alleviate that symptom. For instance, we spoke about shortness of breath with a CHF patient. If the options say patient is short of breath and is placed on 2 liters of oxygen already, even if going by ABC method, airway is always priority. But by using this method, it will not, because there's already an intervention in place for that patient. Already, the patient is already on 2 liters of oxygen and something is already being done about the shortness of breath this patient has. So at this point, this will not be priority. It's Maslow hierarchy of need. Okay. Physiological need would always come first for this patient. How they're feeling at a time, the disease condition, the disease process of this patient will always come first before any other thing. We'll also talk about this. And stable, unstable, this has a lot to do with your vital signs, the lab work of the patient. What are the numbers? What numbers are we dealing with here? First day post-op, second day post-op. Is this patient stable or not? Definitely an unstable patient is who I would attend to first. I'll prioritize care of a patient who's unstable and not for patient who's stable. And the question now is, how do we know if a patient is stable or not? What are the parameters to use to define stability of a patient? Now, this takes me to number, I like to call it danger calls, or I'd say red flags. Okay, they're just like keywords you should just note. All right, when you see an option and it says something as increasing, maybe increasing pain, increasing confusion, increasing shortness of breath, you just know, okay, there's something is going on there. I have to prioritize this particular care for this patient. I have to prioritize this patient amongst others. Danger calls, red flags, that's what I like to call them. These methods are what we would use in the prioritization of care for patients. And your ability to decide on which of these methods to use is dependent on your critical thinking ability and also your decision-making skills. All right. You're going to be faced with a lot of situation where you have to multitask. So that's why you're being tested a lot on prioritization of care. So these skills are very, very important. All right. And to build these skills, you need to do a lot of practice and, of course, know your content. So next, we're going to be talking about prioritization question that has to do with one patient, where you see questions as what's the first intervention and what is the priority intervention, where you have like a listed number of options and you have to pick which one is first and which one is priority. And also, we're going to be attempting a whole lot of questions. Okay, we're going to be breaking each question down using all the methods that we have explained. I will teach you how to switch from one method to another, the right method to use in clinical scenarios that will give you the answer that is expected of you in the NCLEX. See you all in the next episode. And this is Ajao Sandra.